Hello, everyone. Thank you so much for joining us for this very important conversation on brain health equity and the Black community. My name is Pamela Price, and I'm the Deputy Director of the Balm and Gilead, and I also serve as the Director for our National Brain Health Center for African Americans. I am pleased to be with you today to lead and guide this conversation. I look forward to sharing with you as we are kicking off our fourth year of our Memory Sunday campaign. So, Memory Sunday, for those of you who may not know, is recognized on the second Sunday of June. And we created Memory Sunday to really shine a light about Alzheimer's, dementia, healthy aging, and really what that looks like for African American communities, for our congregations, for our families, and for those impacted by Alzheimer's and dementia. And so we are happy to include this conversation as a part of this year's Memory Sunday campaign. Our Brain Health Center, which we launched in 2016, is also pleased again to have the many partners who have joined us, like our Altar program, as well as our partners in our faith communities who participate and make this week and make this campaign so successful. With that being said, I'm also very excited to have introduced this next person who will join me for a part of this conversation as we look at health equity, what that means for us in this Alzheimer's, dementia, and really just in the aging space in general. And so I am pleased to introduce and have joining me today Dr. Monroe Butler. He is a neuroscientist and a neurologist with Biogen Digital Health. I'm going to let him tell you a little bit more about him, but what I can tell you for sure in just our partnerships with Biogen that we have in this healthy aging and cognitive health space, Dr. Butler is someone who is very passionate about not only just the science behind Alzheimer's and dementia, but really about how do we harness all of the tools and resources that we have at our disposal so that we can live and age healthier. So Dr. Butler, thank you so much for joining me for this conversation. I would love for you again just to share more about who you are, your background, kind of what got you here, and really what drives you, in this space, and why this conversation around brain health and health equity is so important to you.
Thank you. I really appreciate this opportunity. Thank you for inviting us to be here. So, yeah, let me tell you a little bit about myself. So I'm a neurologist, and my specialty is in dementia and in brain health. And I'm based in Boston. I work at Biogen in the digital health unit, where I lead research to help us better understand how the brain ages, how it can age in a healthy way, and to develop tools to help us maximize our brain health, lower our risk for developing dementia. And I guess it's a topic I'm really passionate about. Besides it being my specialty within neurology, I think we're all touched by disease personally in some way. And when I think about my development and how did I pick brain science, from a young age, I was around different types of neurologic illnesses from family members that were impacted, and it got me thinking: what are the best ways that we can treat and maximize our brain health? And so, it led to a career in neurology. And when I think today, what's most inspirational about what I do, it's my patients. I've taken care of patients with a variety of types of memory and thinking disorders, and Alzheimer's is the sort of number one most common. And it's my patients that really inspire me to want to help to develop new treatments and new interventions to help us maximize brain health.
That is, first of all, I just want to commend you. It is really easy, I think, to not only hear, but to see your passion, for this. You're on the front line, so to speak, because you're actually getting to interact with patients. But I think you also brought up an important point that is really a driver for a lot of us in this space, is that you got to see what some of these cognitive health challenges or these diseases of the brain at an early age and what they look like kind of up close and personal. And that's really what Memory Sunday is about. It's about shining a light on what living with a brain disease such as Alzheimer's or dementia, what that really looks like, the toll that it can sometimes take on our families, on our communities, and then really just thinking about, well, what can we do to be able to contribute to changing, some of those narratives and changing again, maybe some of the negative impacts of brain disease in these spaces. And so I can't thank you enough. I think for your allyship, for your commitment to this, for our partnership, for the Mommy Gilead of having the opportunity to work alongside Biogen and raising awareness about these issues and what you are doing through your studies, which we're going to touch on here later. But really, just as an organization of being kind of on the forefront of wanting to shine a light, and often sometimes what can be challenging for people to understand what these diseases are, what they look like, how to recognize them. So again, I just want to thank you, again, for your commitment in this fight. One of the other things that I know for us as a organization, which is so important, and why, again, we kind of created Memory Sunday, was really thinking about what are the challenges that the Black community faces in this kind of equity conversation. So what is it that we kind of lack in our awareness or our understanding about these things? And so I would love for you to kind of share your thoughts of what your experiences have kind of shown you as some of those barriers and challenges to getting into these communities and to kind of raising that level of awareness when we talk about Alzheimer's and dementia.
Yeah, I think there's a lot that you touched on there that we can dialogue about, and maybe I'll start with terminology because we speak about dementia and we speak about Alzheimer's sometimes like they're one and the same. And just sort of to start with that term, when we talk about dementia, it's an umbrella term, and there's a lot of different causes for which Alzheimer's is number one. And when we think about vulnerability, the African American community suffers disproportionately. We know from some research that African Americans are more at risk to develop cognitive impairment from Alzheimer's or related dementias as we age, and that unfortunately they've been underrepresented in the research that helps us to better understand it. So when we sort of start with the terms dementia, a lot of causes, Alzheimer's is number one, and in particular, African Americans are particularly vulnerable. So Alzheimer's is devastating. It's a memory thief that comes in the night, slowly, insidiously, over weeks to months, and it robs us of something that is very fundamental, which is our memory and our ability to think. And so, what can we do? What barriers do we have to overcome to be able to help us better understand the disease and make progress, make steps forward towards potential treatments? So let me make one observation about where we are today, because some of us don't have much of a long-term memory about the history of human health. Let's just go back 200 years. Life expectancy is half. What happened? What happened? When you think of the thousands and thousands of years that we've been writing things down and had cultures and civilizations, what happened? That's an explosion in aging. Well, modern medicine, there's a lot of factors, but modern medicine, right? Eradicating smallpox and penicillin, and treating pneumonias. And suddenly our expected age span is much, much longer. And lo and behold, the number one risk factor for Alzheimer's is age, right? Now that we're living longer, what can we do to make the age of our brain stay as young as possible and stave off any decline? And so what I think is sort of a culture that we have today is that we accept that aging comes with cognitive decline. Almost I'm getting older, that's a slip of my memory, a slip of my mind, and we sort of accept that. And yes, there are some subtle changes with age, but we need to think about how to keep that brain muscle as strong as possible for as long as possible. So those are some of the sort of strategies and things I'd love to be able to talk a bit more about, because our brain starts to age not when we're 60, not
Yeah.
when we're 70, but when we're 20, 30, and 40. And we need to start making decisions along our aging lifespan to maximize our brain health and lower our risk of Alzheimer's.
Absolutely. So, and we're going to start digging into that now. So again, I just want to preface again, we are, again, having a conversation, this is, family. If you all could just imagine that we are having an opportunity to be able to sit at the table with Dr. Butler. And so we want to really take advantage of sitting here, that you are a neurologist, you are a neuroscientist. And I think something really important that you just touched on, in what we accept as a normal part of aging, I think also speaks to the fact that we may not even fully understand. You refer to our brain as a muscle. Our brain health is something that we can exercise, that we can keep and maintain it, and that's often we don't hear, talk or narratives that have us imagine or even envision our brain as this muscle or something that we can, train, that we can protect, that we can make it stronger. And so I definitely would love to have you just to talk some more about how we get better at understanding, not just what we do in terms of brain functioning, but what it can't do, and what are those things that we really do have an opportunity to help make it stronger or protect it as we age.
Mm-hmm. Yeah, these are the discussions we need to have. We need to push this into the center of our field of view, and it's brain health. We talk about heart health, like, oh, that's a heart healthy diet, right? Or we say, oh, that's good for my skin health, right? It makes the skin healthy. But we're not talking about brain health, arguably the most important 3 pounds of our body, that controls all of our emotions and thoughts and feelings, is something we need to think, how can we act today to maximize the way that we age? So I alluded to a point that our brain has an age, and about between the ages of 20 to 40 is when it is at the peak of its size and volume and sort of wattage. And very, very slowly after the age of 40, a fraction of a percent, the brain does start to lose a little bit of brain tissue. But if we develop Alzheimer's disease, that aging process is accelerated by 5 to 10 times, and we lose valuable brain tissue month by month, year over year. But a lot of other things are contributing as we age. And what are the things that we can do to alter that trajectory? Because we can alter it. And there are some very good studies that have looked at this over time and give us the evidence to suggest why should we do the things that we recommend. So I think about these as sort of the ABCs of brain health, and where we have good evidence to support why we should be doing it today. And it's never too late to start, and never too early, even if someone is in young adulthood. So ABCs, A is for apple, and that's in reference to our diet. B is for blood, in reference to any of the health conditions that affect our blood. C is for cardio. And then we'll talk about the ABCs, the S's there in a moment. So apple, yeah, an apple a day keeps the doctor away. But we've got very good evidence that over time, having a diet that is minimizing the amount of unhealthy fats, we want that less than 10% of our total diet, and a Mediterranean style diet is much healthier for the body and the brain and can slow aging. So might be familiar with the Mediterranean diet. A lot is sort of written about it, and it's explained pretty clearly for anyone who wants to just quickly reference it online. Another kind of diet that we know is a DASH diet, or one that really helps to minimize added salt in the diet, things that really boost our risk of blood pressure issues. So A is for apple. A Mediterranean diet or fat limited diet is incredibly important because of what it does to the body's blood. And so whatever you put in the body, it eventually has to get shuttled around in the blood. Where does the blood go? Well, the heart's just the pump, and it goes upstairs. So heart health is brain health. Anything you can do to protect the blood. High blood sugars, unhealthy for the body, unhealthy for the brain. High blood pressure, high blood cholesterol. All of these things we know are small insults to the brain as it ages over time. So keeping those things in control as we age, incredibly important. And then in the ABCs, apple, blood, and cardio. Cardio, I'm talking about heart health, yes, is brain health, but physical activity. And there's been a lot of great research, yes, about cardiovascular, right, cardio kinds of exercise, but even weight resistance training, really helping to stave off aging. So you don't need to be, an incredible athlete. You just need to do sort of moderate intensity exercise for 20, 30 minutes a few times per week. And so minding those ABCs is incredibly important. And then the final, the S's, the ABCs, they're plural, sleep and substances. I think we've all heard the message about smoking and its bad effects on our lung health, but really bad effects on brain health. And same with excessive use of alcohol. We don't need to talk about all of the illicit substances, and we know how those can really negatively impact the brain. But limiting our substance and things in moderation, especially when it comes to alcohol. And then sleep. This is a very fascinating subject. At 1/3 of your life, you're asleep. Why are we spending so much time prostrate like this? There's so many important reasons that sleep is involved with regulating our bodies. And what we know, you need enough, or else your brain is going to age much faster. It has to do with stress. It has to do with keeping the sugars in control and the blood pressure. So really having good sleep habits, as simple as these ABCs sound, if you really string those together, you're really boosting your risk of healthy aging.
Wow. So much that I really, again, I hope, those of you who, are, listening to really all the amazing information that Dr. Butler shared. And again, you shared a lot of things that I'm sure many of us have heard: DASH diet or the Mediterranean diet, healthy eating, those types of things. One thing that always kind of sticks out to me in that is that we also know, because we're thinking about, again, health equity, brain health, the Black community, all those things that you mentioned: hypertension, high blood sugars, these kind of cardiovascular related health conditions that disproportionately impact this community. It's almost like you're being able to kill multiple birds, with this one stone, with these kind of ABCs, if you will. So you're not just, addressing that diabetes. You're not just addressing these kind of other chronic diseases that we hear so much about, and you go to, your doctor often about those, but not a lot of communicating around, again, how this is impacting your brain. And so I love that it is, again, it's not to oversimplify that these things are hard, because they're lifestyle changes, their behaviors that we have to incorporate and make them a part of our everyday living. But it really is simplistic when we think about those key things you just pointed out have so much benefit to us beyond perhaps what messaging, how we are being talked to or spoken to when we talk about just our health and wellness in general. And like you said, we have Heart Health Month. We have all these other kind of disease state awareness month, and the focus is solely on those diseases. And rarely do you see, messaging combined to say that if I'm talking to you about these things, please know I'm also talking and supporting you and your brain health. And I think just, again, how we age better. One of the things that I kind of want to take you back to, so you mentioned, I believe you said like that 20 to 40. So where are our brain? And then after that 40-year-old, I wanted to kind of just come back to that, because sometimes, there's also, I think, just like whether we think, aging or, our mental health or our brain health declines, automatically with aging. I think younger individuals, not yet 40, maybe in their 20s, maybe in their 30s, but definitely that kind of pre, 50s age. There's not a lot of conversation then to say, what are you doing now to help, with your aging down of the road? And so I'd love if you could just touch on that a little bit more to say these are things, these ABCs are things we should look at, not just beyond our 40s, but even earlier. Would love to get your thoughts on, you know, even in adolescence, and how and what would you recommend, as families, as communities, to begin to have these conversations around brain health and reframing it kind of across the lifespan, so to speak.
Mm-hmm. Yeah, I like that we also want to put in the center the youth, and it's out of sight, out of mind, right? You see the skin, and you see maybe someone's weight, and you can make assumptions about what you think's going on, but you don't see a brain. But what you can see and observe are behaviors. And I think our focus for the youth and for young adults should be creating the correct habits of mind, and that we are spirit, mind, and body. We're not just these different organ systems, even though that's how medicine handles it. Like, okay, the kidneys are failing, well, let's go to the kidney doctor, right? The brain is failing, now it's time for the brain doctor. It's not how we should be thinking about it. So the message is education and engagement. And I mean that in a lot of different ways. So correct habits of mind have to do with educating ourselves, not just about medicine or health, eating right, or being physically active, but about educating ourselves in any area. A major risk factor for dementia is someone having low educational attainment and not continuing on with their studies. So we talked about that brain size and sort of hitting that 30 to 40, but we know that the development and the huge growth of the brain as we're going from age 0 all the way on up to 20 is an incredibly important period. So the right habits of mind that are engaged with education of any sort for as long as possible, being lifelong learners of a topic. And the second is engagement. And I mean that in a lot of different ways. Engaged in our communities, being socially embedded, being committed and involved to a community, whether it's a faith community, a sports team. Being involved and feeling like you are an owner and a part of something is such a healthy habit, and something we have to work hard at. And I think being intentional about that and making sure that our youth are being educated, and they're being educated to cooperate and work together in communities, are some of the most important foundations that we can lay for healthy brain aging.
Wow. And again, this kind of cements again kind of why we want to have these types of conversations, bring these conversations, bring the community into these conversations. Why we want these to be a part of things such as Memory Sunday, or such, is our work with our Brain Health Center, because it really is, like you said, it's that engagement, it's that awareness, and it's looking at it maybe beyond, or looking at it in ways that we maybe were not taught. But again, constantly looking for new ways to engage and new ways to connect. I think, like you said, is just really, really so important. Something else that you brought up also, because you mentioned that there's studies that help us understand why these ABCs and the things that you mentioned are so important. And then you also mentioned that we haven't maybe done as well when we think about how we better understand the actual diseases themselves, like Alzheimer's, dementia. And that is the lack of kind of representation, that we don't have the right communities, the right individuals in those studies and in that research data that is so important for us to continue to further our understanding of Alzheimer's and dementia. So I'd love to kind of have you share why that is so important, not only in this space, but I think as we think about just health and aging and equity as we move forward, what we've learned from COVID-19, about why diversity, the equity, the inclusion, it has to be more intentional, and why that is so important. And I think beyond new treatments, yeah, that gets stuck on, well, we need that to get new treatments, but I think studies teach us more than just getting to new medications or new therapies. And so I'd love to have you share, your thoughts on why that diversity and that inclusion is so critical to this conversation.
Mm-hmm. When it comes to brain health, this is about everyone. And when it's Alzheimer's, we know it's no respecter of person. And it doesn't matter your creed, it doesn't matter your background. But when we do look at the numbers, some populations are more vulnerable. And as I mentioned, for instance, older African American, these individuals compared to non-Latino whites bear a greater burden of the disease of Alzheimer's and dementia. And if so many people, 1 in 8 over the age of 65 in the United States is suffering from dementia, and Alzheimer's is the top cause, and African Americans are disproportionately affected, we're missing something. There's something there, maybe social determinants of health, maybe some of the biology. And so we have to study the complexity of a disease that's really increasing rapidly because we're aging more and impacting us in a way that is disproportionate to what you would expect from the numbers that represent our true society. So research is the way we do that. It's not just about a drug trial, but it is about general research to help us understand brain aging better. And so if you think African Americans are more at risk for Alzheimer's than to the contrary, then they're underrepresented in historically our clinical trials. And if we want to take evidence from these trials to develop new treatments or bring us a step closer to better treatments, then we need the individuals in the trial to represent the populations that we want to treat. And so I think we need to foster a mentality, foster a culture of participation and of contribution to research. If we want to bring new treatments to our future selves and to our loved ones today, then we have to think, how can we contribute and how can we invest our time to be able to grow our knowledge of brain aging?
And I think, so much, one key thing that you said and you mentioned and you touched on, I think, was how we were going to contribute. Again, I think we all, as you mentioned, why you do this work, why it's so important to you, what it means to you to see the individuals that you treat, the patients, clients that you have. But I think it's, what you said is that there's a way for us all to be able to contribute to the science, contribute to figuring out what we don't know. So that we can, again, collect, because like you said, Alzheimer's, to have a disease that is so devastating, and as you said it, that it robs us of that something so precious, again, as our memory, and seeing loved ones lost twice almost in a sense, in a mental mindful way, and then losing them eventually physically, as we're talking about, again, something that has no cure. I would hope that everyone feels led again, to think about, well, what can I do, if even if you've never experienced it, you don't know anyone living with it, but to, as you kind of pointed out, there is a way for us all to be able to contribute something to this space and something to this conversation. And so I think that's just really, really, really important. I wanted to kind of pivot just a little bit, because as you mentioned, so you are with Biogen, but you are in their digital health space. And so Obviously now because of COVID, all of us, whether you like technology or not, you have you have probably had to expand your use of some type of digital, technology to communicate, to see your doctor, to grocery shopping. It's a lot has shifted. But I'd also like for you to share that in this digital health space, how is that now kind of positioned to help us as we think about or as we reimagine brain health and aging?
Mhm. Yeah, I think the pandemic has really caused a rapid shift of the world to figure out how to live remotely from one another, but still engage. And how do we deliver healthcare? How do we take care of, how do we monitor patients and their symptoms? And how do we still screen people that are at risk for developing more severe diseases like Alzheimer's? So I've been working in the Biogen digital health units, and I've been at Biogen for 4 years. Really, in on the heels of the start of the pandemic, we thought, how can we take our trials and think about how to make them completely virtual or completely remote? And so we've designed a brain health study that is completely remote called the Intuition Brain Health Study. And so, in this setting of being distanced from one another, how can we study brain health? And it's the digital devices, it's the everyday consumer tools that we have around us. We know that aging individuals as well are gradually increasing their use of technology. So we developed this study to use the tools of everyday technology, smartphones, smartwatches, personal computing devices to be able to study brain health. And so one way to get more involved with research is to find these virtual trials. There's no burden. You don't got to drive to the medical center and find parking and take half the day. This is something you can do from the convenience of your own home and contribute to our understanding of the brain, and then help us to actually develop the new tools, because the future of the tools in digital medicine will be digital. And in the same way that music slowly went analog to digital over several decades, the same thing is happening to medicine as we speak. Is an analog to digital transformation. So I think it's going to bring a lot of convenience, right? The convenience of seeing a physician remotely, or giving information about your health remotely without sort of the burden of having to travel, or the time and expense that could take. So this is helping us think about trials differently. So happy to say a bit more about the intuition study, or happy to talk more about digital medicine.
Yeah, and actually, yeah, would love to kind of talk about both, because what I thought was really interesting. So, when we often have conversations or we hear about clinical trials and we hear about, again, these barriers, and I think once you get over the common ones that come up a lot, mistrust and things of that nature. What I have really enjoyed in terms of learning more about what you've done with the intuition brain health study is that you kind of really chose to tackle some of those other barriers, as you mentioned, the time commitment, being able, how do we access it? So if we are removing, some of those. So I would love to kind of, have you share from that kind of digital health space, why, Biogen, why your team felt that, we wanted to make sure that we could look at some of those, barriers that sometimes people don't think that you can address when you're talking about research and study, and kind of how you chose, to say well, really challenge yourselves to say, can we create something that removes those barriers? And then if so, how do you see the digital health, how do you see that being able to address some of the issues that we have when we think about equity and getting more diversity into studies and trials?
Mm-hmm. Yeah, a lot of really important questions embedded in that. And I think what we were thinking about, not knowing that a small infection was going to go global and cause a pandemic, we were thinking, how do we lower barriers to access to research? And how do you collect research information in a real world setting. Because in the end, what matters is what's meaningful to people in their everyday life. So I could design a drug to adjust the sugars in your bloodstream by 5 points, but you feel no different. There's no difference to how you live your daily life. Um, but a statistician is so happy about those 5 points for some reason. Well, in the end, it's not going to have any cash value to people. It needs to matter to them in their everyday life. And when it comes to dementia and brain health research, um, we see how much the day-to-day function is so different as people develop the early signs of dementia. So we thought the best way to study behavior was when people are behaving as they typically do from day to day. And so that's the mindset we had, is how do we lower barriers to access? And then how do we actually measure what matters to people is how they live their life and being able to communicate with one another and move and live in the world. So I think that was sort of the inspiration.
Yeah.
And the next step was thinking, well, how do we put tools in the hands of patients and people it should be in charge of their health, that come to the medical system with their needs, or don't come to the medical system maybe out of fear or mistrust. So how do we develop the tools, put them in the hands of patients, so that they can decide the discussions that they want to bring to the healthcare system? So that's how we thought of this trial, is developing tools that would be patient facing for them to use to help them think about brain health, start that conversation with their doctor, and ideally early detection of the earliest signs of dementia.
And that too is such an important role, because I think you mentioned, you touched on the disparities and the increased vulnerability that we know the Black community has when we look at Alzheimer's and dementia. But that late diagnosis is also a real major challenge. That by the time you do get to that specialist, you do finally get it, they're in such later stages. And so again, if we think about, as you kind of even alluded to earlier, if we think about brain health as this continuum, as this a part of living life, from decade to decade as we age, but then also using technology as a way for us to understand, in our daily lives, in real time, what behaviors, again, that we are, interacting or engaging with, what are the benefits to us as individuals, as opposed to kind of this contextual, the larger group. And again, if it wasn't a representative group, as you said, how much value did that really add to the individual? And so I love this kind of, we talk about meeting people where they are, but this is a study that not is only looking to meet individuals kind of where they are, but it's actually saying, I want to hopefully, as we are meeting and engaging with you where you are in your real life, not wanting to disrupt what you are doing and taking of your time. But then we want to be able to, again, to say, well, what tools work best? It's almost, if we think about that equity picture sometimes that we see, and you've got the boxes and then everyone's on the same box, and then you figure it out like, well, this person may need 3 boxes, no box, those types of images. The way that you've kind of laid this out is that you would be able to hopefully find tools that would work for me, that then would also work to someone else who, again, based on my life, my behaviors, as opposed to trying to make it a one size fits all, is really, I think, commendable. So I'd love if you could share just a little bit more about the study. I do know, just for everyone, watching and viewing, we have a flyer about the study provided to us by Dr. Butler that gives an overview and information about it. But I'd love for you to share, more about it, how people can learn more about the study and get involved or get more information about it.
Sure, absolutely. And I think there's information through the website, as you said, intuitionstudy.com. You can also go to learn more. And let me briefly tell you, what is the study like? What are we trying to do? And who's eligible? So this is a study in over 20,000 US-based residents that launched last September, and we are currently enrolling, actively looking for people that are 50, 60 years old and up. And individuals have to be pre-existing iPhone users. This one big cinch point to the eligibility for the study. And it's a totally virtual study that you navigate by downloading the Intuition Study app on your iPhone, if you have a version 8 or newer, and you can enroll in the study in a matter of minutes. What are we asking people to do? What are we trying to accomplish? So this is a totally virtual study that would last 2 years, that you can participate in and decide to drop from the study at any moment. So it's completely volitional. And any individual who is a pre-existing iPhone user can come into the study, and we provision or give an Apple Watch to you as a part of the study, and you can earn that watch by performing activities. So the study is 2 years, 24 months, and we really don't ask much of people. We ask them to use their phone as they normally do. We mail people a watch and say, wear the watch as much as is comfortable for you. And there's a lot of interesting information that we get from those devices that can tell us about people at risk for dementia, those at the earliest stages, and those that don't have high risk and maybe are at younger ages. So 24 months, we say 24 hours of commitment spread out over 24 months. So basically, you invest about 1 day's worth over those 2 years. And people can earn several $100s. They can earn the Apple Watch to do a few activities. One, just use your phone as you normally would. Two, wear the watch and use it as you typically would, a consumer device. And then there's a few survey questions and little thinking and memory activities that we have people do. And that's the sort of 24 hours of work spread out over the 2 years. So each month for about 30 minutes, people do little brain games and activities on their computer. Each season, they, for 2 weeks, do little brain activities on the phone. And we just answer questions about your health history and basic updates about how things are in your life, stress, sleep and diet and mood, all those things that really can affect our day to day. So when it's all said and done, we're going to use that information, and we have groups of individuals that are more or less at risk of dementia, and see how this information can predict who was changing during the study, who developed cognitive issues, and who didn't. And this also helps us to measure what matters to people in the day-to-day, and using the information that is out there anyways, but in a very private, controlled research setting. And so the tools that we're trying to develop from the study would be a brain health tool. So you can put on an Apple Watch and say, I want to know if my heart rate goes below 50 beats per minute, and you get an alarm. Or if you have atrial fibrillation, or irregular heart rhythm, you can ask to be warned that maybe you're in an irregular rhythm. In that same vein, what if the health kit had a brain health tool where over time, it sees if there's been changes that might suggest that our cognitive wellness is more or less changing or staying the same. And then this puts tools in your hands to decide how you want to use that information. Like, okay, I got my checkup. I'm 65. I need to check my cholesterol and blood sugars. I want to talk to my doctor about brain health and see where things are at. So this is to start those conversations and to give people tools if they want to use them to monitor their brain health. So that's the study. We're actively looking to enroll people. We're hoping within the next few months to have all 23,000 individuals into this study. So now is the time. And like I said, the big cinch point is being an iPhone user for this particular study.
Yeah. And I mean, and you say cinch point, I think if you think, and again, I'm sure as you guys thought about that and we're doing the build out and things for it, that is predominant. As you said, we have more and more older adults who are using technology. They have, these smartphones, and obviously Apple products are a huge, corner of that market. So I know some people say, well, why, you didn't just open it up to all, types of phone users, but I get the premise behind that, and definitely want to kind of ease anyone's, questions of, again, does that exclude individuals, and to say no. And I would hope, again, everyone would take an opportunity to visit the website to, learn more about what Dr. Butler just shared, because as you were talking, and then really just kind of sharing about kind of what the premise and what those kind of outcomes and those tools, and putting those in the hands of individuals, the word that came to mind was empowering. Because that dynamic oftentimes between us and how we engage and interact with our healthcare system and healthcare providers is not one where the patient is made to feel empowered to say, I want to bring up this concern, or I want to bring up this issue with my healthcare provider. And so I think that's something, again, when we think about how we can contribute, as you mentioned earlier, in it, you've eliminated so many of those, pain points for individuals to participate, in a study. You've gotten some amazing incentives, again, just, earning the Apple Watch, being able to complete, I kept thinking about how many people since COVID, you do your Wordle every day. Some people are adamant about making sure that's the first thing they do at the start of the day is the Wordle. So again, like you said, you've created something that allows us to be in our space, to be ourselves, living our authentic lives, and still being able to use technology to capture some really, really rich data that, again, when it's kind of all said and done, keeps, or puts us rather, in a driver's seat that I think too often we don't find ourselves, of being able to be our own best advocates, for ourselves and for our families. So I really, really hope, that everyone, again, will take an opportunity to check out the study. As Dr. Butler said, they are actively enrolling. It definitely, that, I think you said 50 to 60 years of age, and then making sure you kind of got that requirement of an Apple phone, an 8. So that takes you way back. So for those, if you're kind of like my husband, and once you get a phone, you never want to get rid of it. An 8 is several iPhone generations ago. And so we really, really hope, again, that you'll, take us up on learning more about that. And contributing, again, thinking about what our role could be. It really sounds amazing. And I'm really looking forward, again, to kind of seeing, these tools and what, could be done, and how our communities can benefit from them. Kind of, I want to give you an opportunity to just give and share with us some final thoughts really on, moving as we move, forward, as we think about, the next year, as we think about aging, as we think about how, conversations around equity continue to change, and they continue to, I think, in a good way, they continue to be at the forefront of organizations and institutions, including those in this brain health space. But I'd love to kind of give you the floor for just some final thoughts on what you want, individuals not only to know and perhaps understand, but more importantly, what you would call or ask them to act on and to actually do.
Mm-hmm. Again, thank you for having me, and starting these conversations that need to be had. And I think I'll start first by saying I want people to know how much their behaviors and decisions today, at any age, impacts how well their brain can age, and that we do not have to passively accept that we will lose our memory or lose our thinking as we age, and that there's things we can do today. Contributing to research is one of those things that can help that process of understanding the best ways for us to age. And so I appreciate this opportunity, to talk about the ABCs and things that we can do today with our habits and behaviors. But for the neuroscience and the medicine to move forward as we move increasingly into a digital world where we can measure patients and give tools to patients themselves to monitor their brain health, I want to help you all think creatively about what some of those opportunities are. And getting involved with the intuition study, I think, is one of those great examples where, from the convenience of your own home without having to take too much time, you can help us better understand the things that put us at risk to age in an unhealthy way. So there is sort of a final message here that I'd like to make, and it's about fighting. And we've all interfaced with the medical system. I've been on both sides as patient and as doctor, and there's so much that is frustrating about the system. And you almost feel like you have to advocate for yourself about every little thing. And it's unfortunate that it can be that way, but do not let that system frustrate you from being proactive about what you can do for your health. So you have to fight back against the system, so to speak, and take proactive steps to be an advocate for yourself. But you also have to think, how can I fight back against disease? And contributing is one way to do that. So really appreciate the opportunity to have these conversations, and I hope to be able to engage people and help them better understand healthy aging.
Absolutely. And again, I just want to thank you as well. Really can't think of, again, a better note, that key word to fight. Those of us in our faith community, we say often, we want to fight the good fight. And there are things now that we could do to, as you stated, to fight that fight, so that we can age better, that we can age collectively as a community, in a way, like you said, what we do today is going to determine, that future, health of our brain, that future health of our communities, the health of our congregations. I think it's all, connected. And I agree that we all have to make sure that we are willing to fight, advocate, so that we can start to change these narratives and change the conversation when we talk about brain health and cognitive health, and even in the Alzheimer's and dementia space. So I definitely want to thank you. I will share and let everybody, Dr. Butler is a part of the Baum-Gilead family. I want to, again, his passion for this work, both in the digital health space, but also just, again, caring about wanting to see our communities better and healthier, cannot be understated. So again, we thank you as well, again, for your partnership. We thank you for your commitment to this work. We thank you for taking of your time and sharing of your expertise, and challenging us to think about what we can do and how we contribute to this health equity and brain health conversation. So I just want to thank you as well. I want to thank each of you again for joining us for this conversation. We, as always, the Baum-Gilead looks forward to bringing more of these engaging conversations with subject matter experts like Dr. Butler, so that we can have the information and have those tools to make better decisions for ourselves, for our families, for our congregations. And so we hope that you will, again, continue the conversation with us on social media. We hope that you'll check us on the website as well at baumandgilead.org/Memory Sunday to learn more about what we will be doing for the rest of this week. I also just want to remind everyone as well that we have our Down by the Riverside concert that we will be bringing to you on Memory Sunday, this coming Sunday. Again, wanting to just pay tribute to our history, wanting to pay tribute to where we are, as well as where we have come, and really just lifting up the power of music, the healing power of music, what music is for those who are living with Alzheimer's and dementia. And so we hope again that you would just stay connected with us, learn more about how you can get involved, definitely learn more and enroll in the Intuition brain health study. I do it myself if I met the eligibility requirements. So please, again, just learn more about that because we all have a role to play. So thank you so much for joining us, and we will see you for the next conversation.